So I'm meant to talk next, so we'll catch up, and I'm going to talk about the OCT Action Plan along with colleague Kimberly O'Connell, who's going to talk about the Respiratory Hazards Working Group, and Nancy Bradshaw, who is co-chair or supporting the OCT Action Plan from the Ministry of Labour and Training and Skills Development, which I have not. I've been saying MOL for a long, long time, as have we are. So now we all have to learn about a few new, everybody. So I won't dwell on this because many of you know about the OCT Action Plan, but not everybody does. So this is just an intro and to let you know where you can find more information. And it's actually a plan. There's some stats here about OCT disease, but I don't think we need to, I think we all recognize that OCT disease is massively underreported, and even though it's underreported, it's still, the cases that are allowed are generally about double the number of traumatic fatalities when you think about fatalities, but of course many, many, many more people have their health and their lifestyle affected by occupational disease than dying itself. So it's a major issue. So that's the reason that we have an OCT Action Plan. When we started it, the focus was on aligning efforts around the system. So there's an occupational health and safety system that includes the MOL, but also includes 6 health and safety associations, includes research centers. And it's to try and get everybody working together. It's a massive issue, so one step at a time, and with the goal of occupational disease prevention with the objective to prevent exposure, so kind of exposure focused in Ontario workplaces to reduce the incidence and burden of occupational disease. And the priority exercise was done based on the available evidence at the time, which came from research and data that all the various organizations had from their work in the field. But also what was going on in the current environment, like in a regulatory environment, as well as issues in the newspaper and things like that. It's trying to. We're really very much opportunists, trying to take advantage when there's interest to sell our story. Basically, that work can be unhealthy and harmful, but there are ways to prevent that. So priorities were chosen, and it did build on ongoing work, but that was done sort of individually. It's trying to synergize, totally. We could name our project Synergy, maybe. And there is a link here, which I'll just show you, but I won't dwell on, but it's just, we do have the OCT Action Plan posted on the OHCOW website. We also have a longer introduction by me, not talking quite so fast, about it, and we did a poster for the CARA conference in Research and Work and Health that sort of it's a pictorial that you can link to from the site. So just showing you where you can find out more. And then the members, as I said, at least it's written out for me here, the Ministry of Labour, Training and Skills Development, the WSIB, ourselves, and the 4 HSAs, Infrastructure, Public Health, Workplace Safety and Prevention Services, and Workplace Safety North, as well as the Centre for Research in Occupational Disease and the Occupational Cancer Research Centre. We've also involved Public Health Ontario and the Lung Association Ontario chapter, and that's been very valuable. And yes, our word chart there is really all about collaboration. And the approaches are based on 8 different sort of strategies and trying to, depending on the issue, trying to leverage different ones. But we really recognized from the start that intelligence and decision support was a key issue because it was really lacking, assessing data and how it relates to each other, and then how that can inform prevention. And as Paul already mentioned, there's a lack of data and a lack of intelligence, but there's also a bunch of data out there that doesn't really speak to each other, and so it's trying to find a way to make that meaningful. And then to foster the creation of more research and data is actually a separate issue. So it's being it's gathering intelligence to support our decisions, but also to foster more research and data, to raise awareness, advise and support, which the HSAs do in their sectors, provide education and training, enforcement and monitoring, develop programs, for instance, the WSIB HCEP program or other employer support programs. And then, of course, regulatory impact, regulatory influence, and in the terms of legislation and regulations. And the structure is basically pretty simple. There's an implementation team, and there are 5 working groups. The priorities that were determined by from the beginning were actually noise, diesel exhaust, and allergens and irritants, as well as striving to get more about workplaces put into electronic medical records, and also, what's the 5th one? Oh, pardon me? No, I'm actually forgetting what the 5th one is. So EMR, the 3, and then just raising awareness about OCT disease in general, which October is one of the things that does that, right? And then we've added respiratory hazards. So the implementation team, I'm currently the chair with Nancy, who's going to step up soon, and it sort of meets quarterly, oversees, sets sort of guides, priorities, and it's a great room. There's a buzz in the room. It's actually really hard to get them to stick to the agenda because there's so much excitement of, oh, we're doing this and we're doing that, and did you hear about this? So it's a great team, and I'm really proud to be part of it. And then we have 5 working groups who are the ones rolling up their sleeves and doing the work on intelligence and decision support, noise, diesel, allergens and irritants, and now respiratory hazards. And they are focusing on what's out there in terms of an environmental scan, prioritizing where a difference can be made due to need or opportunity, or both, hopefully, and then coming up with some deliverables and actually doing things. And this is just the list of staff. Kevin, you've already met, is the chair of the Diesel Exhaust Committee. Wagish Yajaman is the chair of the Noise Working Group. Unfortunately, he's not here today. Lynn Holness, who will speak to us later, is the chair of the Allergens and Irritants. And Kimberly, who's going to step up shortly, is the chair of Respiratory Hazards. And Victoria is the chair of Intelligence and Decision Support, but also supported by Avril Beaubien from the ministry as well. And these is just sort of some what's happened over time. Just to say, 2016 we got people together, we made these priorities, we developed a plan. 2017 okay, now we're a team. OCT disease awareness was chosen as a system priority, sort of separate from the ODAP at that time too. We started the working groups who were at different stages, partly because of the level of understanding about the hazard they represent. And then Noise took the lead to do something about International Noise Awareness Day, and that sort of set a model of leveraging days, international days, a model of developing tools and sharing them, and social media, and also knowledge translation. And then in 2018, the allergens and irritants set their sub-priorities. Diesel and Noise did some webinars, and we did the CARWA poster. 2019, just last year, we have a new website, which we launched on World Cancer Day, once again, leveraging things. The Respiratory Hazards Working Group started, which you'll hear about, and we had input into the Healthy Worker, Healthy Workplace initiative and a strategy that's being developed. And of course, 2020 is soon, in a few months. So now we're already looking forward. This is the end of the 3rd year. So what should we do next? So just some sort of overall accomplishments from my perspective is that really we have achieved a level of system coordination and collaboration within organizations. Interestingly, that many organizations, field staff, and staff that come to meetings didn't necessarily communicate and didn't really understand, well, what do we mean by OCT disease, and what can we do about it? So that's been helpful within, and then of course between and across organizations. And then just building capacity, a lot of the education has been internal as well as external facing. Trying to engage more stakeholders is something that we're still striving to do, and so this is an event like that, but also it's been presented at many different conferences, and starting to involve people in our working groups who aren't specific to the system, because that's the reality check we need, right? The concentration on exposure reduction versus it's not a cancer prevention action plan. It's an OCT disease action plan, but it's focused on exposures, many of which are a concern because they cause cancer. But I think that's an important point, that we've sort of shifted the system to that. Fostering recognition and investment in finding, generating, interpreting, sharing, and learning from evidence and data. So it's moved the conversation into evidence-based but also that fostering of research or finding the research and having a new insight from the lens. This year we did create the Prevent OC Disease website, which basically is a repository for a bunch of resources that are sorted on the basis of type of hazard. They're sorted on the basis of the occupations that and what they might be exposed to. So you can search things on there by occupation, and you can search things on there by the hazard itself, and you can search things on there by disease as well. And it's really just in its beginning, this website. We've got several hundred resources, but there are way more in the world that we think would be of value. So we do invite people. There is a place to submit a resource, and there is, which I think I'll leave it up here so you guys can look at a special set related to respiratory hazards too, which they can talk about later. So going back to the PowerPoint, I think, just as I already said, really one of the accomplishments is getting ready for ODAP 2.0. It's reflecting on, okay, we've been able to, reach these people. Maybe we've made a change here, but, how do we make it even better now? That's really the stage that we're at. And there's some information here on the working group highlights, but I don't know if we really have time to do it. So, maybe I shouldn't, let me see what time it is. So we will make these available, but yeah, so it's just working on finding a lot of data that's out there and making it accessible for our study was part of it, and then also submitting for some grants in order to have more meaningful data, so that we're in the process. So that's the resources prioritized for development. Diesel's been doing a lot of work with other, you guys come up, doing a lot of work with other stakeholders. Kevin's linked with a lot of people, and that's really helped us a lot. They've done a webinar, as I said before, the allergens and irritants. The big thing with them is defining the priorities of wet work, isocyanates, preservatives, and cleaning agents as being the key priorities for that working group, and then they've developed actually sector-specific materials on all of those. And you'll hear a bit more from Lynn later. And noise, as I already talked about, is the leader. So I think I'm going to segue over to Nancy to talk about healthy workers and healthy workplaces.
Thanks, Val. And I just want to actually just mention that the individual that was working with the co-chair used to be, was Stephen Grossman until I joined the prevention office. And Stephen did an amazing job in working with Val and working on this committee. So I just wanted to acknowledge his work. Healthy workers and healthy workplaces. So this is an initiative that's currently happening. It's an enforcement blitz, and it's also about raising awareness about respiratory hazards and MSDs in workplaces. The blitz is happening right now from October. It started on October 1st, goes till the end of December. But to help raise awareness, we also, the prevention office and the communications branch, worked on a toolkit that has been uploaded to all the HSA sites. And the idea of the toolkit is just to provide resources and social media content. We provided tools, covered topics such as the hierarchy of controls, race, links to the regulations, to make it easy for any workplace champion to start a conversation in the workplace about respiratory hazards and MSDs. We really want people to start that conversation, get talking, whether it's just, if it's a safety talk, which is a little bit more formal, or just start to talk about the issues, how they can improve control in the workplace and do any problem solving. So that was the purpose of the toolkit. Because we were having this Healthy Workers, Healthy Workplaces initiative, we thought this was a really good opportunity at ODAP to start our own respiratory hazards working group. So that was the impetus for the group, and I'm going to pass this along to my colleague Kimberly.
So, along with Nancy, we had the very good idea of the participants of ODAP from the history that Val gave. We thought, well, why not leverage this Healthy Worker, Healthy Workplace initiative, this focus on respiratory hazards, and create a working group to support that and leverage it. But we're not done there. So this is the beginning of the working group. We just came together in the summertime and really focused on getting all the system partners together with all of their resources, getting it all on to prevent OC disease. So there's a one-stop shop for people to prevent OC disease. And we're just beginning this working group. And without further ado, we met yesterday. And had an excellent talk that I want to share with you all. I also want to implore, I want to take a minute to just go back to, this is the time where everyone online and in the room realize that they are part of the Occupational Disease Action Plan. So please, you are the action. Go to your joint health and safety committees. Remember the internal responsibility system. If you're a consultant, if you're a hygienist, if you're a safety professional, you are part of the Occupational Disease Action Plan, and we need you instead of talking to one another, which we're not. We don't want meetings, we want action. So this is, part of what I'm hoping to bring to the table with this working group. And I also wanted to mention that we're not dropping emerging issues. So we also began a nanotechnology working group out of Ottawa. We included Health Canada. We included National Research Council. This isn't a club. You all belong to the club if it is. So we want to expand our horizons. We're involving public health. We're involving as many people as possible. So come and join us. I implore you in your day-to-day lives as Joint Health and Safety Committee, health and safety reps, workers, please. Where our work continues with the Respiratory Hazards Working Group, and yesterday, you can read all about what we've done to date and more. You'll hear more about what we plan to do, but reaching across to the coast, we had the BC Construction and Safety Association speak to our working group yesterday about an amazing tool that they've developed as a result of regulatory change 4.5 years ago in BC. And Dr. Hugh Davies, you're going to hear from soon as well, from UBC, was part of this project. So I'd like to call up Melanie Gorman-Ing, and trying not to get too far behind, to speak to us about the Silica control tool that was presented to the working group just yesterday. So thanks, Melanie.
Okay, this one's me. That one?
Yep. Here you go.
Okay, great. Hi, everyone. Yes, so we came yesterday to present this to the Respiratory Hazards Working Group. I just have a few slides, just a summary of what we've done in BC for silica control in the construction industry. So as Kimberly mentioned, several years ago we had some regulatory change in BC for silica. Basically, WorkSafe BC, who's the regulator in BC, introduced a new whole section of regulation specifically related to silica. We have an 8-hour occupational exposure limit of 0.025 milligrams per cubic meter, which is a lot lower than what you have here. It's the ACGA-HTLV. And one of the challenges in this new regulation, especially for construction employers, was that there was now a requirement to monitor exposure for any work activity that could generate respirable crystalline silica dust, which on construction work sites is, most things can generate this dust. So you have to monitor the exposure, and you also need to create a written exposure control plan of what you're going to do to control exposures. About over half of exposures to respirable crystalline silica across Canada are in construction, and it's challenging in construction to monitor and control silica or anything actually because it's a dynamic work environment. Things are changing rapidly. People are moving around, doing different things day to day. And also, there's it's mostly small businesses who operate in the construction sector. In BC, and I think it's very similar here in Ontario, 92% of employers have less than 10 employees, and most of those, 85% of all employers, have less than 5 employees. So it's a lot of small businesses. They don't have in-house occupational hygiene expertise. They don't have exposure measurements. They don't have the resources to hire consultants to take these measurements. So it was going to be a big challenge to meet these regulatory requirements. So the organization that I work for now is the BC Construction Safety Alliance, and it's a industry association that provides services and training for the construction industry. So they partnered with UBC and the regulator, WorkSafe BC, to come up with with a web tool that construction employers could use to help them to meet these new regulatory requirements. And so I think we started work on this back in 2014, and then we were working towards having something to be available in place right as soon as the new WorkSafe BC regulatory requirements came into effect. So what we came up with is called the Silica control tool, and this is what we presented yesterday. It's a web tool that helps to connect employers with existing data, because there is data out there on silica exposure levels associated with different construction activities. It's just hard for the employers to access that data, and because it's in published journals, it's in people's private databases. So we tried to put together all of the data that we could find and put it into a kind of centralized database, and then we coded that into a web tool that construction employers can then access to, so they can use this existing data to make exposure control plans. We also thought it was a good opportunity to make a sort of educational resource. So when people are working through this tool, they can learn a little bit about silica. So what you do basically, yesterday I did a demonstration of it, but I don't have time to do that today. But basically what people do is they log into the web tool and they enter information about what construction activity, like what tool they're using, what material they're working with, what task they're doing, what sort of work site they're on, and then they go through this process, and it comes up with an exposure estimate for them, and then compares that to the exposure level, and then they are given an opportunity to select different possible control measures that they could use, like local exhaust ventilation or wetting, and then it goes through again and creates a new exposure estimate for them, and then they can see if they're now below the exposure limit or not, and if they still need respiratory protection, and then it creates like a whole written plan for them. So it's designed really for people with no occupational hygiene knowledge to go through and use. And then they're able to produce effective exposure control plans that they can then put into place on their work site. It reduces the effort and the cost associated with creating these exposure control plans. And because we sort of vet all the data that goes into the database, we know that all the data that people are using meets their requirements and for the regulatory requirements. And also it's good data that is actually going to give people meaningful information that will help to keep workers safe. The Silica control tool, basically it's based on a database of over 4,000 personal RCS measurements that we put together. I've already gone through this bit, so I'm going to skip this slide. But yeah, in conclusion, I think this is it's an exciting project, because it's a way to take exposure data that exists and use it beyond just, taking the measurement, using it for your compliance assessment, and then never looking at it again. It's able to go in to a database, and people can use it going forward, and everyone can share their data. We've had good uptake by industry. We have over 2,000 registered users in BC now who've created, I think, over the life of the tool, which went into effect in 2017, I think they've created over 4,000 exposure control plans with it, and I hear from people all the time who are using it in their work sites. It also encourages exposure measurement, so we have people who they go into the tool, and the activity that they want to do is not available because we don't have the data on it, so it's not available in the tool. So then that then prompts the employer or the BC Construction Safety Alliance to go and take the measurements that are required to add this new activity into the tool. So monitoring is ongoing of silica exposures in construction, and anytime we identify a new source of data, we just put it straight into our database, and then we can update the tool. So it's sort of a living tool that is being updated all the time. Hugh Davies, who also came to the meeting, he talked about some continuing research that we're doing. So we're continuing to do research in this area. We're developing like new modeling techniques for improving this tool. We've done some research in other provinces in Alberta and Manitoba so far, where we've done some research to see how feasible it would be to use this approach in other provinces. And that's actually something I should mention, that our data that we have is not all from BC, and this approach could easily be adapted for other jurisdictions. It would just be a matter of kind of updating the regulatory information in the tool. So it's been really successful so far in BC, and that's all I had to say about that. So I hope we have time now for break. Okay, thank you.
Does anybody have any questions for Melanie?
How did you advertise?
Sure.
So the question is, how did they advertise it?
Yeah, well, we had I think it was a social media campaign that went out and there are construction industry journals that there were advertisements in about it. We did educational training for the regulatory inspection officers so that they all learned about it and what it is and how it works. So that because we were concerned that people would start using it and then the inspectors would not know what it is and reject it. So we did a lot of training of that, and so now the inspectors, if they go to a work site where people are not adequately controlling silica, they sometimes recommend, okay, there is this website you can use, and consultants know about it, so they use it with their employers. So yeah, it's been a gradual process, but the word is getting out about it. Mm-hmm.
Melanie, there's a question from the web.
Okay.
It says, are the exposure estimates generated from the tool's published data accepted as measuring exposure as required by regulation?
Yeah, in BC they are. There's a clause in the regulation that says that you can use measurements from an equivalent work process. So as long as you are using measurements from an appropriate and equivalent process, you're not like trying to fit your activity into something where it doesn't really fit, then yeah, it would be accepted. Mm-hmm.
Thank you.
Yeah.
Great, thanks a lot,
Yeah,
Melanie.
thank you.
Okay.